I'm so happy you're here, and I wanted to take you through a protocol that is super quick, easy to follow, and can really help your patients and other clinicians understand just what aspects of anatomy and function you're looking at with regard to sleep-disordered breathing. This is the Fairest 6+4. So we're going to do the Fairest 6, and then we're going to add 4 more elements that we're going to go through at the end. Now, just a little background about the Fairest 6 project. This tool was launched in 2017 after a strategy symposium at Stanford with Christian Guilleminault that was organized by Mark Moeller to identify key myofunctional disorders. With the leadership and guidance of Dr. Soroush Zaghi, Cynthia Peterson developed this tool with other clinicians, researchers, all dedicated to advancing the science of identifying myofunctional disorders. And with Christian Guilleminault's legacy, she dedicated this tool to him and all of us. And that means you, people who are advancing all of this work to really help and intervene to get in early and identify things before they advance into disease states. So let's go on to the 6+4. The first thing we're going to look at is the nose. Are they able to breathe exclusively through the nose for 3 minutes straight? It's a simple yes or a no. The second is mentalis strain. So what this describes is there a compensation when they close their lips? Does the mentalis muscle overactivate to keep those lips together, either from a growth or development, either retrognathia, vertical maxillary excess, whatever it is? That's what you're really identifying. There's a compensatory movement of strain in the mentalis muscle. The third area is tonsil hypertrophy. So do the tonsils occupy 0 to 25% of the oropharynx? They may have been removed, or that space is occupied by 25%, or do they occupy between 25 and 50%? Now on this protocol, it's really above or below 50%. So above 76% to 100% of the airway, that would absolutely warrant further evaluation, possibly tonsillectomy. But the 50 to 75%, that would be an area to consider and to have further evaluation. So this next area is looking at ankylglossia using the tongue range of motion ratio. So the way that you calculate this percentage is by opening the jaw, and you're going to measure the jaw opening range of motion. That's going to give you your denominator. The next number is when you elevate your tongue to the incisive papilla. What does that create in terms of a ratio? What is the percentage? If it's grade 1, you have above 80% of range of motion. That's really good. Grade 2, less range of motion. Grade 3, significantly less, and grade 4 is severe. So you can really see by these images and percentages what that numerical value is showing in terms of tongue restriction. All right, the next area to look at is dental wear. Do you see signs of attrition, gum recession, or abfraction? Anything that you see visibly that is showing that grinding or signs of wear on the teeth, mark that yes or no. The last element on the Fairest 6 is the narrow palate. So using the intermolar width between the mesiolingual cusp of the first molar, you're going to measure and use the index around what is considered normal or narrow. This is also looking at the arch shape. And of course, is there enough room for the tongue? Moving on to the +4. This is going to be the signs of sleep-disordered breathing in adults. So the first element is tongue scalloping. We know this is a clinical marker of a sleep disorder, and you're going to see the scale of severity from the least to the most severe and mark it accordingly. This, of course, as you know, is the tongue pushing into the teeth, possibly at nighttime, but even during the daytime, and really shows a tongue space issue or a movement of the tongue that's pressing into the teeth and making those indentations. The next one is tongue overflow. So using a lingual palatal suction, we're going to assess tongue space. When you suction the tongue up, does it give the presentation that the tongue is inside the teeth? Is it going outside of the teeth? And you can see the severity from the least to the most severe, and this is really giving you more information about that tongue space problem. Now, the Friedman tongue position. So unlike the Malampati where you stick the tongue out, this is really going to be asking the patient to open and keep the tongue in, and you're going to look in to see what is there. So if you see on the left is the least severe and on the right the most severe, that grade really shows all of the soft palate. You really only see the hard palate. This is going to show the severity scale, and obviously that's going to be the worst condition related to breathing, especially at nighttime. Okay, so this next area is palatal flutter. What you're going to do is actually put your tongue down and make a snoring sound, and then do it the same way, but tongue up, lips closed. Do you still make that snoring sound or not? This is actually adapted from the Pong-Rottenberg method of reliability to show as a prognosticator for snoring surgery. So this has been used to assess if snoring reduction would be the outcome of the surgery. Now, in this case, we're going to use it as a prognosticator for, is myofunctional therapy alone going to ameliorate your sleep disordered breathing? And if you have that snoring sound, which is a negative PR, palatal flutter, then you are definitely going to need more than just myofunctional therapy. It's really going to give you more information that reduced tongue space is also an issue, and the oropharynx and posterior part of the tongue in that area is going to need an architectural intervention, such as surgery or orthodontics, etc. There are other aspects of the Fairest 6+4. I want you to take a look at it. We're going to do this together, but I do want to say a big thank you to Cynthia Peterson and the Breathe Institute and Dr. Zaghi for guiding me through so I could better share what this is about and help others do what we're all trying to do, which is to intervene in the best, most effective and efficient way possible. Thank you.